There are many commercially available variations of the classic LMA. The Ambu Lma device has a much more acute angle in its tube, closely mimicking the normal curvature of the oropharynx. Like other LMA devices, it is available in several sizes. Its tip is reinforced to decrease the chance of it backfolding on insertion, and it has an integrated bite block. It is recommended that the cuff be fully deflated for insertion. Unlike the classic LMA, it is not necessary to direct the Ambu Lma into the posterior pharynx with a finger. The low-profile cuff facilitates its placement around the tongue and into the posterior pharynx.
There are a number of supraglottic airway devices on the market. An example, other than a classic LMA, is the Ambu supraglottic or laryngeal airway. And there are certain advantages of this over a classic LMA, including its preformed shape. It nicely preforms around the pharyngeal angle, as well as a built-in bite block and a reinforced tip that prevents folding upon insertion. The recommendation for this would be, before inserting, to remove all air out of the cuff, as well as to lubricate the non-laryngeal side of the cuff. For insertion, again, we want to open the mouth with head tilt or a jaw thrust or scissor technique. And upon entry in through the mouth, contact with the hard palate and then the soft palate is required in order to guide the tube around the angle of the tongue. This is inserted quite easily here, and insertion goes until resistance is felt. Typically the teeth are between these two white lines, which signify where the bite block is. Insulation of 15 to 20 cc's of air may lead to the supraglottic airway rising just slightly, creating the optimal seal in the lower pharynx.
Negative pressure pulmonary edema is a rare but critical complication in patients having general anesthesia. It results when a patient attempts to inspire against an obstruction. Typically, this happens during emergence from anesthesia when the patient bites and occludes either an LMA or endotracheal tube. Strong inspiratory pressures against an obstruction will quickly disrupt the alveolar capillary membranes, resulting in acute hemorrhage into the lungs. The patient becomes critically ill, and the clinical picture mimics that of pulmonary edema. This rare complication is discussed further in Chapter 25 of the Ottawa Anesthesia Primer. The Ambu Lma integrated bite block is an important development that has essentially eliminated this complication.